Question 1. Strategic planning requires a certified pastoral counselor, BCPC, to develop a comprehensive wellness plan for a client who expresses a strong desire to integrate their deeply held spiritual beliefs into their journey towards improved mental and emotional well-being. Which of the following actions best reflects a holistic and ethically compliant approach within the BCPC regulatory framework? Option A. The counselor focuses exclusively on evidence-based psychological interventions, advising the client that spiritual matters are outside the purview of professional pastoral counseling and should be addressed separately. Option B. The counselor attempts to provide spiritual direction and theological interpretation for the client's life challenges, acting as an authority on spiritual matters to guide the client's decision-making. Option C. The counselor guides the client in identifying and utilizing their own spiritual resources, practices, and community connections as integral components of their wellness plan, respecting the client's self-defined spiritual framework. Option D. The counselor encourages the client to adopt specific prayer practices and scripture readings from the counselor's own religious tradition, believing these to be universally beneficial for spiritual growth and mental health. The correct answer is C. The counselor guides the client in identifying and utilizing their own spiritual resources, practices, and community connections as integral components of their wellness plan, respecting the client's self-defined spiritual framework. Explanation. This scenario presents a professional challenge because a certified pastoral counselor, BCPC, must integrate a client's spiritual beliefs and practices into a holistic wellness plan while adhering to the BCPC ethical guidelines and the relevant regulatory framework governing pastoral counseling. The challenge lies in ensuring that the integration is client-centered, respects the client's autonomy, and does not impose the counselor's personal beliefs or misinterpret the scope of pastoral counseling practice as defined by the BCPC. Careful judgment is required to balance the spiritual dimension with other aspects of wellness without overstepping professional boundaries or engaging in practices outside the recognized scope of pastoral counseling. The correct approach represents best professional practice because it prioritizes the client's self-defined spiritual framework and empowers them to identify relevant spiritual resources for their wellness journey. This aligns with the BCPC ethical commitment to client autonomy and the principle of respecting diverse belief systems. By facilitating the client's exploration of their own spiritual resources, the counselor acts as a guide, ensuring that the wellness plan is deeply personal and sustainable. This approach is consistent with the BCPC emphasis on a holistic understanding of well-being, which inherently includes the spiritual dimension as understood and defined by the client. An incorrect approach that focuses solely on the counselor's personal spiritual tradition fails to respect client autonomy and may impose beliefs that are not congruent with the client's own spiritual identity. This violates the BCPC ethical mandate to avoid imposing personal values and to work collaboratively with clients. Another incorrect approach that dismisses the spiritual dimension entirely as outside the scope of pastoral counseling misunderstands the foundational principles of the profession, which explicitly acknowledge and integrate the spiritual aspect of human experience. This would be a failure to provide holistic care as envisioned by the BCPC. A third incorrect approach that attempts to diagnose or treat spiritual issues as if they were solely psychological or medical conditions without appropriate referral or collaboration with other professionals would also be a regulatory and ethical failure, as it exceeds the defined scope of practice for a pastoral counselor and could lead to harm. Professionals should employ a decision-making framework that begins with understanding the client's presenting concerns and their spiritual context. This involves active listening, open-ended questioning to explore the client's spiritual beliefs and practices, and a commitment to client-led exploration. The counselor should then assess how these spiritual elements can be integrated into a comprehensive wellness plan, always in collaboration with the client. This process requires ongoing self-reflection on the counselor's own biases and a commitment to continuous professional development in understanding diverse spiritual traditions and the ethical practice of pastoral counseling. Question 2. Which approach would be most appropriate for a certified pastoral counselor, BCPC, conducting a clinical assessment for a congregant experiencing significant marital distress, ensuring both ethical practice and effective client care? Option A. Offer spiritual guidance and comfort based on pastoral experience, assuming the congregant is seeking only spiritual support and not a formal clinical evaluation. Option B. Conduct a standard clinical assessment using only objective psychological instruments, without explicitly addressing the pastoral relationship or the congregant's spiritual beliefs. Option C. Clearly define the clinical assessment process, obtain informed consent regarding the dual role of pastoral support and clinical evaluation, and proceed with a structured assessment while respecting the congregant's spiritual context. Option D. Refer the congregant to an external clinical therapist immediately without any initial pastoral counseling or assessment, citing potential dual-role conflicts. The correct answer is C. Clearly define the clinical assessment process, obtain informed consent regarding the dual role of pastoral support and clinical evaluation, and proceed with a structured assessment while respecting the congregant's spiritual context. Explanation. Scenario analysis. A pastoral counselor is tasked with conducting a clinical assessment for a congregant experiencing significant marital distress. The challenge lies in balancing the pastoral role of spiritual guidance and support with the professional responsibility of objective clinical evaluation. The congregant may feel more comfortable sharing deeply personal information due to the existing pastoral relationship, but this can also create a dual-role conflict, potentially compromising the counselor's objectivity and the congregant's autonomy if not managed carefully. The counselor must navigate the ethical imperative to provide competent care while respecting the boundaries inherent in both pastoral and clinical roles. Correct approach analysis. The correct approach involves a clear delineation of roles and informed consent. This means explicitly informing the congregant that while the counselor is a trusted pastoral figure, they are also operating in a clinical capacity for this assessment. This includes explaining the purpose of the assessment, the limits of confidentiality within a clinical context, e.g., mandatory reporting, and the potential benefits and risks. This aligns with ethical guidelines for pastoral counselors, which emphasize transparency, competence, and the avoidance of dual relationships that could impair professional judgment or exploit the client. By establishing clear boundaries and obtaining informed consent, the counselor upholds the congregant's right to self-determination and ensures the assessment is conducted ethically and effectively, prioritizing the congregant's well-being. Incorrect approaches analysis. One incorrect approach would be to proceed with the assessment solely from a pastoral counseling perspective, offering spiritual advice and comfort without a formal clinical assessment framework. This fails to meet the professional standards of clinical assessment, potentially overlooking critical diagnostic information or therapeutic needs that a structured evaluation would uncover. It also blurs the lines between pastoral care and clinical service, which can lead to misunderstandings about the scope of intervention and the counselor's responsibilities. Another incorrect approach would be to conduct a purely clinical assessment without acknowledging or integrating the pastoral context. This might involve using standardized clinical tools without considering the congregant's spiritual beliefs or the role of faith in their distress and coping mechanisms. Such an approach risks alienating the congregant, failing to build rapport effectively, and providing an incomplete picture of the individual's overall well-being, thereby not fully leveraging the unique strengths of pastoral counseling. A third incorrect approach would be to delegate the clinical assessment to another professional without adequate consultation or understanding of the congregant's pastoral needs. A referral is sometimes appropriate. Doing so without a thorough understanding of the congregant's spiritual context or without ensuring the referred professional is equipped to handle such nuances can lead to a fragmented and less effective therapeutic process. It bypasses the counselor's unique ability to integrate pastoral and clinical insights. Professional reasoning. Professionals should first identify the nature of the request and their own competencies. If a clinical assessment is requested and falls within their scope of practice, the next step is to establish clear boundaries and obtain informed consent, detailing the nature of the service, its limitations, and the counselor's role. This involves a conscious decision-making process to manage potential dual-role conflicts by prioritizing the client's welfare and adhering to ethical codes. If the request falls outside their expertise, a professional referral with appropriate consultation is the next step. Question 3. The review process indicates that a pastoral counselor is working with a client who expresses significant distress related to a chronic illness. The client articulates a theological belief that their suffering is a direct consequence of past sins and a form of divine punishment, which they believe must be endured without seeking external intervention for relief. How should the pastoral counselor best approach this situation to facilitate healing while respecting the client's theological framework? Option A. Explore the client's understanding of sin, punishment, and divine justice within their faith tradition, seeking to identify alternative theological interpretations that offer hope and avenues for healing, while affirming the client's spiritual journey. Option B. Focus primarily on the emotional and physical symptoms of the illness, providing comfort and support for their distress, while setting aside the theological discussion as a separate, potentially unresolvable issue. Option C. Advise the client that their theological interpretation is a significant barrier to healing and encourage them to seek guidance from their religious leader to reconcile their beliefs with the need for therapeutic intervention. Option D. Gently challenge the client's interpretation by introducing theological perspectives that emphasize God's redemptive love and the possibility of healing through faith, suggesting that suffering is not always punitive. The correct answer is A. Explore the client's understanding of sin, punishment, and divine justice within their faith tradition, seeking to identify alternative theological interpretations that offer hope and avenues for healing, while affirming the client's spiritual journey. Explanation. Scenario analysis. This scenario presents a common pastoral counseling challenge, where a client's deeply held theological beliefs about suffering directly impact their willingness to engage in therapeutic interventions. The pastoral counselor must navigate the delicate balance between respecting the client's faith framework and facilitating healing, ensuring that theological interpretations do not become barriers to care. The challenge lies in discerning when a theological stance is a genuine expression of faith, and when it may be a manifestation of resistance, fear, or a misunderstanding that can be addressed within a pastoral context. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a client-centered, integrated model of care. It acknowledges the client's theological framework as foundational to their identity and worldview. By seeking to understand how the client's theology of suffering informs their present experience, and by exploring potential avenues for healing that are congruent with their beliefs, the counselor acts ethically and effectively. This approach aligns with the BCPC commitment to integrating spiritual and psychological well-being, respecting client autonomy, and employing evidence-informed pastoral care practices. It avoids imposing external interpretations and instead collaboratively seeks meaning and pathways to healing within the client's existing spiritual landscape. Incorrect approaches analysis. One incorrect approach fails by rigidly adhering to a singular theological interpretation of suffering without regard for the client's personal understanding or the potential for growth within their faith. This can be seen as a failure to respect client autonomy and can lead to spiritual distress or alienation, violating ethical principles of pastoral care that emphasize empathy and individualized support. Another incorrect approach might dismiss the client's theological framework as irrelevant or as a direct obstacle to healing, attempting to impose a secular or alternative perspective without adequate integration. This disregards the profound influence of faith on a person's life and can be perceived as disrespectful, judgmental, and a violation of the counselor's role to support the whole person, including their spiritual dimension. Such an approach risks causing harm by invalidating the client's core beliefs. A third incorrect approach might focus solely on the emotional distress without adequately exploring the theological underpinnings that the client themselves has identified as central to their experience. While addressing emotional pain is crucial, neglecting the theological dimension, when it is presented as significant by the client, represents an incomplete pastoral counseling process and fails to leverage the client's own resources for resilience and healing. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening and empathetic attunement to the client's presenting concerns, including their theological perspectives. The next step involves a collaborative exploration of how these beliefs intersect with their current struggles. The counselor should then assess whether the client's theological framework is a source of strength or a perceived impediment to healing. Interventions should be co-created, ensuring they are congruent with the client's values and beliefs, while also being informed by sound pastoral counseling principles and ethical guidelines. This process requires ongoing assessment, flexibility, and a commitment to the client's holistic well-being. Question 4. The analysis reveals that a pastoral counselor is working with a client who presents with significant anxiety and feelings of spiritual doubt following a recent personal crisis. The counselor has extensive training in cognitive behavioral therapy, CBT, and believes its focus on identifying and challenging maladaptive thought patterns could be beneficial. However, the client also expresses a strong desire to explore the spiritual dimensions of their struggle and find meaning through their faith tradition. Considering the BCPC ethical framework and best practices in pastoral counseling, which of the following approaches best reflects a responsible and effective decision-making process? Option A. Focus exclusively on the client's spiritual doubts and existential concerns, setting aside the CBT training as it may not be the most appropriate fit for addressing the client's immediate distress. Option B. Integrate elements of CBT with a spiritually attuned approach, exploring how the client's faith can inform their cognitive restructuring and provide a framework for meaning-making, while remaining open to adapting the CBT model as needed. Option C. Apply the core principles of CBT directly, assuming that addressing the client's cognitive distortions will inherently resolve their spiritual doubts and anxiety, without significant modification or integration of spiritual elements. Option D. Primarily utilize CBT techniques to address the client's anxiety, focusing on thought patterns and behaviors, and suggest that spiritual exploration can be pursued separately with a clergy member. The correct answer is B. Integrate elements of CBT with a spiritually attuned approach, exploring how the client's faith can inform their cognitive restructuring and provide a framework for meaning-making, while remaining open to adapting the CBT model as needed. Explanation. This scenario presents a professional challenge because the pastoral counselor must navigate the ethical and practical implications of applying a specific counseling theory to a client, whose presenting issues may not align perfectly with the theory's core tenets. The challenge lies in ensuring client welfare and therapeutic efficacy while adhering to professional standards and the specific ethical guidelines of the Certified Pastoral Counselor, BCPC. Careful judgment is required to avoid imposing a theoretical framework that could be detrimental or ineffective for the client. The correct approach represents best professional practice because it prioritizes a client-centered, integrative, and evidence-informed methodology. This involves a thorough assessment of the client's unique needs, cultural background, spiritual beliefs, and presenting concerns before selecting or adapting a theoretical model. It acknowledges that no single theory is universally applicable and that flexibility and a willingness to integrate elements from various approaches or to modify a chosen theory are crucial for effective pastoral counseling. This aligns with BCPC ethical guidelines that emphasize competence, client welfare, and the use of appropriate interventions. An incorrect approach that rigidly adheres to a single, potentially ill-fitting theory without considering the client's individuality would represent a failure to exercise due diligence and may lead to a misdiagnosis or ineffective treatment. This could violate ethical principles of beneficence and non-maleficence, as the client might not receive the most appropriate care. Another incorrect approach might involve prematurely abandoning a chosen theory due to minor client resistance, without exploring the underlying reasons for the resistance or attempting to adapt the theory. This could be seen as a lack of perseverance and a failure to fully explore the potential of a therapeutic alliance. A third incorrect approach might be to solely rely on the counselor's personal theoretical preference without a systematic assessment of the client's needs, which could lead to a lack of objectivity and potentially harm the client by not addressing their core issues effectively. Professionals should employ a decision-making framework that begins with a comprehensive client assessment, including their presenting problems, strengths, cultural context, and spiritual framework. This assessment should then inform the selection of appropriate counseling theories and models, prioritizing those with evidence of efficacy for similar issues. The counselor should remain flexible, prepared to adapt or integrate theoretical approaches based on the client's ongoing response and progress. Regular self-reflection and consultation with supervisors or peers are also vital components of this process to ensure ethical and effective practice. Question 5. Cost-benefit analysis shows that investing significant time in exploring a client's deeply held, yet potentially unconventional, spiritual beliefs, even when they differ from the counselor's own, ultimately leads to more profound and sustainable spiritual growth for the client. Pastoral counselor is working with a client who expresses a desire to deepen their spiritual life, but is exploring spiritual practices that are outside the counselor's own faith tradition and may be viewed as unorthodox by mainstream religious communities. The counselor believes that encouraging the client to explore these avenues, while providing a safe space for reflection and discernment, is crucial for the client's authentic spiritual formation. Option A. The counselor should share their own personal spiritual experiences and practices extensively, encouraging the client to adopt similar methods as the most effective path to spiritual growth. Option B. The counselor should focus exclusively on the psychological aspects of the client's distress, suggesting that their spiritual explorations are a symptom of underlying psychological issues that need to be addressed first. Option C. The counselor should gently guide the client to explore the theological underpinnings and potential spiritual benefits of their chosen practices, offering resources from various traditions that might resonate, while always affirming the client's right to self-determination in their spiritual journey. Option D. The counselor should express concern about the client's exploration of potentially unorthodox practices and steer them towards more established and theologically sound spiritual disciplines within a recognized faith tradition. The correct answer is C. The counselor should gently guide the client to explore the theological underpinnings and potential spiritual benefits of their chosen practices, offering resources from various traditions that might resonate, while always affirming the client's right to self-determination in their spiritual journey. Explanation. This scenario presents a professional challenge because it requires balancing the pastoral counselor's commitment to spiritual formation and growth with the ethical imperative to respect client autonomy and avoid imposing personal beliefs. The counselor must navigate the delicate line between offering guidance rooted in their faith tradition and ensuring the client's spiritual journey remains their own, free from undue influence or coercion. The core tension lies in discerning when encouragement crosses into manipulation, particularly when the client is in a vulnerable state. The correct approach represents best professional practice because it prioritizes the client's self-determination within the context of their spiritual journey. By offering resources and facilitating exploration without dictating a specific path, the counselor upholds the ethical principle of client autonomy. This aligns with the BCPC emphasis on respecting the diverse spiritual and religious beliefs of clients and empowering them to make informed choices about their own spiritual development. The counselor's role is to be a guide and facilitator, not an arbiter of spiritual truth for the client. An incorrect approach that involves strongly advocating for a specific denominational practice or theological interpretation, even with good intentions, fails to respect client autonomy. This could be seen as imposing the counselor's personal beliefs, which is an ethical violation. It risks alienating the client or creating a dependency where the client feels they must adopt the counselor's views to achieve spiritual growth. Another incorrect approach, such as dismissing the client's expressed spiritual concerns as secondary to psychological issues, fails to recognize the integral role of spirituality in holistic well-being, a core tenet of pastoral counseling. This approach devalues the client's lived experience and can hinder genuine spiritual formation. A third incorrect approach, focusing solely on the counselor's own spiritual practices as the model for the client, also violates professional boundaries and disrespects the unique nature of each individual's spiritual path. Professional decision-making in such situations requires a process of careful discernment. The counselor should first actively listen to and understand the client's expressed spiritual needs and desires. Then they should consider their own ethical obligations, particularly regarding autonomy and non-maleficence. The counselor should assess their own biases and ensure they are not projecting their personal beliefs onto the client. Finally, they should explore a range of potential interventions that support the client's exploration and growth, always prioritizing the client's agency in their spiritual journey. Question 6. Market research demonstrates that clients often seek pastoral counseling for rapid resolution of their concerns. A pastoral counselor, credentialed by the BCPC and trained in solution-focused brief therapy, SFBT, is meeting with a new client who expresses a strong desire for quick fixes to their problems. Which of the following approaches best aligns with the ethical and professional standards of a BCPC credentialed pastoral counselor utilizing SFBT in this situation? Option A. Acknowledge the client's desire for speed and assure them that SFBT will deliver immediate and definitive solutions to all their issues within a few sessions. Option B. Gently explore the client's understanding of quick fixes and collaboratively discuss how SFBT focus on identifying strengths, exceptions, and desired future outcomes can lead to effective and sustainable solutions while managing expectations about the therapeutic process. Option C. Explain to the client that SFBT is not about quick fixes and that they may need to consider a different therapeutic approach if they are unwilling to engage in a more in-depth process. Option D. Immediately provide a series of actionable, short-term strategies designed to address the client's stated problems, assuming their definition of quick fixes is synonymous with effective therapeutic outcomes. The correct answer is B. Gently explore the client's understanding of quick fixes and collaboratively discuss how SFBT focus on identifying strengths, exceptions, and desired future outcomes can lead to effective and sustainable solutions while managing expectations about the therapeutic process. Explanation. This scenario presents a professional challenge because a pastoral counselor, operating within the Certified Pastoral Counselor (BCPC) framework, must balance the client's expressed desire for a specific therapeutic modality with the ethical imperative to provide care that is both effective and aligned with professional standards. The BCPC, while not a governmental licensing body in the same vein as state licensing boards, upholds ethical guidelines and professional competencies that pastoral counselors are expected to adhere to. The challenge lies in discerning whether the client's request for quick fixes aligns with the principles of solution-focused brief therapy, SFBT, as practiced by a competent pastoral counselor, or if it indicates a misunderstanding of the therapeutic process that could lead to unmet expectations or superficial engagement. The correct approach represents best professional practice because it prioritizes a collaborative exploration of the client's goals within the established framework of SFBT. A BCPC-credentialed pastoral counselor is trained to understand the core tenets of SFBT, which, while brief and focused on solutions, still involves a structured process of identifying strengths, exceptions, and desired futures. This approach respects the client's agency by inquiring about their understanding and expectations, while also ensuring that the therapeutic relationship is grounded in realistic possibilities and ethical practice. It avoids imposing a predefined solution and instead facilitates the client's own discovery of solutions, consistent with SFBT emphasis on client empowerment and resourcefulness. This aligns with the BCPC commitment to ethical practice, which includes competence, client welfare, and informed consent. An incorrect approach that focuses solely on providing immediate, superficial answers without exploring the underlying client strengths or desired future state fails to adhere to the principles of SFBT. This could lead to a therapeutic relationship that is not sustainable or truly beneficial, potentially violating the BCPC ethical guidelines regarding competence and client welfare. Another incorrect approach that dismisses the client's desire for brevity without understanding its roots might alienate the client and fail to engage them in the therapeutic process effectively. This could be seen as a failure to adapt therapeutic strategies to the client's expressed needs, potentially impacting the counselor's ability to provide effective pastoral care. A third incorrect approach that overpromises rapid, definitive solutions without acknowledging the complexity of human experience or the collaborative nature of therapy would be ethically problematic, as it sets unrealistic expectations and could be perceived as a lack of professional integrity. Contrary to the BCPC standards, professional decision-making in such situations requires a process of active listening, empathetic inquiry, and a clear understanding of the chosen therapeutic modality. The pastoral counselor should first seek to understand the client's perspective on quick fixes and what that means to them. Then, they should gently educate the client about the principles of SFBT, highlighting its strengths-based and future-oriented nature, while also clarifying that it is a collaborative process. The counselor should assess the client's readiness for this type of therapy and explore potential challenges or misunderstandings. This iterative process of understanding, educating, and collaborating ensures that the therapeutic alliance is built on a foundation of trust, realistic expectations, and ethical practice, ultimately serving the client's best interests within the scope of pastoral counseling. Question 7. During the evaluation of a pastoral counseling client who expresses feelings of hopelessness and mentions feeling like a burden, what is the most ethically and professionally appropriate initial step to take regarding potential risk assessment for self-harm? Option A. Reassure the client that these feelings are common and will likely pass, and encourage them to focus on positive aspects of their life. Option B. Empathetically explore the client's feelings of hopelessness and burden, directly inquire about any thoughts of self-harm, and assess their intent, plan, and available protective factors. Option C. Immediately contact the client's family or a designated emergency contact to inform them of the situation and request their support. Option D. Advise the client that if they are experiencing thoughts of self-harm, they should seek immediate medical attention from a hospital emergency room. The correct answer is B. Empathetically explore the client's feelings of hopelessness and burden, directly inquire about any thoughts of self-harm, and assess their intent, plan, and available protective factors. Explanation. This scenario presents a significant professional challenge due to the inherent complexity of assessing risk in a pastoral counseling context, particularly when dealing with potential self-harm. The counselor must balance the duty of care with the client's autonomy and confidentiality, all while operating within the ethical and legal boundaries of pastoral counseling, as defined by the Certified Pastoral Counselor (BCPC) framework. The BCPC framework emphasizes a client-centered approach, the importance of maintaining professional boundaries, and adherence to ethical guidelines that prioritize client well-being and safety. The correct approach involves a multifaceted risk assessment that includes direct, empathetic inquiry about suicidal ideation, coupled with a thorough exploration of protective factors and coping mechanisms. This aligns with best professional practice by directly addressing the potential risk, while simultaneously seeking to understand the client's internal resources. The BCPC ethical guidelines mandate that pastoral counselors take reasonable steps to ensure the safety of clients when there is a clear and imminent danger to themselves or others. This includes assessing the severity, intent, and plan for self-harm. Furthermore, it requires the counselor to explore the client's support systems and their capacity to engage in safety planning. This approach respects the client's dignity and promotes collaboration in managing the crisis. An incorrect approach would be to solely rely on the client's assertion that they are fine without further exploration. This fails to meet the BCPC ethical obligation to actively assess risk when it is a concern. It prioritizes a superficial understanding over a diligent assessment, potentially overlooking critical indicators of distress. Another incorrect approach would be to immediately break confidentiality and contact external authorities without a thorough assessment of the immediate danger and exploration of less intrusive interventions. While mandated reporting is a consideration, it is typically a last resort after other safety measures have been explored and deemed insufficient, and it must be done in accordance with BCPC guidelines regarding when and how to breach confidentiality. A third incorrect approach would be to dismiss the client's feelings as simply a phase or a cry for attention without a comprehensive risk assessment. This demonstrates a lack of empathy and a failure to take the client's expressed distress seriously, violating the core principles of pastoral care and ethical counseling. The professional decision-making process in such situations should involve a systematic risk assessment protocol. This includes 1. Establishing rapport and creating a safe space for disclosure. 2. Directly asking about suicidal thoughts, intent, and plans. 3. Assessing the presence of protective factors, e.g., social support, reasons for living, coping skills. 4. Evaluating the severity and imminence of the risk. 5. Developing a collaborative safety plan with the client, which may include increased support, crisis hotlines, or professional referrals. And 6. Documenting the assessment and intervention plan thoroughly. If imminent danger is identified and cannot be mitigated through collaborative safety planning, then appropriate steps to ensure safety, which may include involving emergency services or designated support persons, must be taken in accordance with BCPC ethical guidelines and relevant legal mandates. Question 8. Compliance review shows a pastoral counselor is working with a congregant who expresses a strong desire to make a significant financial donation to the church's building fund, citing a recent spiritual revelation. The counselor has known the congregant for many years and is aware of their modest financial situation and a history of being easily influenced by perceived spiritual directives. The congregant is insistent and seems to interpret any hesitation as a lack of faith. What is the most ethically sound course of action for the pastoral counselor? Option A. Advise the congregant that such a significant donation from their financial means would be spiritually unwise and suggest they reconsider, framing it as a pastoral concern for their well-being. Option B. Gently explore the congregant's understanding of the donation, its implications for their personal finances, and any external pressures they might be experiencing, while affirming their spiritual journey and offering continued support regardless of their decision. Option C. Immediately proceed with facilitating the donation as requested, recognizing the congregant's spiritual conviction and the church's need for funds, to avoid undermining their faith. Option D. Report the congregant's intention to the church's finance committee and denominational leadership for their guidance on whether the donation should be accepted, without further discussion with the congregant. The correct answer is B. Gently explore the congregant's understanding of the donation, its implications for their personal finances, and any external pressures they might be experiencing, while affirming their spiritual journey and offering continued support regardless of their decision. Explanation. This scenario presents a professional challenge due to the inherent tension between a pastoral counselor's duty of care and the principle of client autonomy, particularly when a client's expressed wishes may be influenced by factors that raise ethical concerns. The counselor must navigate the complexities of spiritual guidance, mental well-being, and the potential for undue influence or coercion within a pastoral context. Careful judgment is required to uphold the client's dignity and self-determination, while ensuring their well-being is not compromised. The correct approach prioritizes a thorough, non-coercive exploration of the client's decision-making process. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, as well as respecting client autonomy. By engaging in open dialogue, assessing the client's understanding, and exploring potential external pressures, the counselor acts in accordance with the BCPC ethical guidelines, which emphasize informed consent and the avoidance of exploitation. This approach allows the counselor to fulfill their pastoral role by offering support and guidance without imposing their own beliefs or dictating the client's choices. An incorrect approach that immediately dismisses the client's request based on the counselor's personal theological interpretation fails to respect client autonomy and may constitute a violation of professional boundaries. This approach risks imposing the counselor's own values rather than facilitating the client's spiritual journey. Another incorrect approach that proceeds with the request without further exploration, despite recognizing potential concerns, neglects the duty of care and the responsibility to ensure the client is making a truly informed and uncoerced decision. This could lead to harm if the client is acting under duress or misunderstanding. A third incorrect approach that involves consulting with denominational leadership without the client's explicit consent or knowledge violates client confidentiality and autonomy, potentially creating a breach of trust. Professionals should employ a decision-making framework that begins with active listening and empathetic understanding. This is followed by a careful assessment of the client's capacity to make the decision, exploring their motivations, understanding of consequences, and any potential external influences. The counselor should then clearly articulate their own ethical and professional boundaries, offering support and resources while respecting the client's ultimate right to choose, provided it does not involve clear harm or illegality. Transparency and ongoing dialogue are crucial throughout the process. Question 9. The assessment process reveals that a client, who identifies as a devout member of a specific Christian denomination, presents with significant anxiety stemming from a perceived conflict between their understanding of divine sovereignty and their personal responsibility for life choices. The client expresses a desire for counseling that honors their faith. Which of the following approaches best integrates theological foundations with pastoral counseling best practices? Option A. Interpret the client's anxiety as a spiritual attack and recommend increased prayer and fasting as the primary therapeutic intervention, without further psychological exploration. Option B. Reframe the client's anxiety as a sign of spiritual immaturity and encourage them to accept their perceived lack of control as a testament to their faith, thereby minimizing the need for further counseling. Option C. Explore the client's theological understanding of divine sovereignty and personal responsibility, seeking to identify how these beliefs are contributing to their anxiety, and collaboratively explore how their faith tradition offers resources for integrating these concepts in a way that promotes peace and agency. Option D. Advise the client that theological interpretations are outside the scope of pastoral counseling and focus solely on secular cognitive behavioral techniques to manage anxiety symptoms. The correct answer is C. Explore the client's theological understanding of divine sovereignty and personal responsibility, seeking to identify how these beliefs are contributing to their anxiety, and collaboratively explore how their faith tradition offers resources for integrating these concepts in a way that promotes peace and agency. Explanation. This scenario presents a professional challenge because the pastoral counselor must navigate the intersection of deeply held theological beliefs with the practical application of psychological principles in a counseling context. The BCPC certification implies adherence to a specific ethical code and a framework that integrates faith and mental health. The core of the challenge lies in discerning how to honor the client's theological framework while ensuring that the counseling interventions are therapeutically sound and ethically responsible, without imposing personal theological interpretations or misapplying theological concepts in a way that could be harmful. The correct approach represents best professional practice because it prioritizes a client-centered methodology that respects the client's theological worldview as a foundational element of their identity and well-being. This approach aligns with ethical guidelines that mandate cultural and religious sensitivity, ensuring that counseling interventions are congruent with the client's values and beliefs. By seeking to understand the client's theological framework as a source of strength and meaning, the counselor can leverage these elements to foster resilience and facilitate healing, thereby promoting holistic well-being in a manner that is both theologically informed and psychologically effective. This respects the client's autonomy and dignity. An incorrect approach that misinterprets or misapplies theological concepts risks causing spiritual harm, undermining the client's faith, or creating a therapeutic impasse. For instance, imposing a rigid theological interpretation that contradicts the client's lived experience or understanding could be seen as a violation of the counselor's duty of care and could be considered an ethical breach of competence, particularly if the counselor lacks adequate training in the specific theological tradition or its application in counseling. Another incorrect approach might be to compartmentalize faith in counseling, treating theological beliefs as irrelevant to the therapeutic process. This fails to acknowledge the integral role of faith in many clients' lives and can lead to superficial or ineffective counseling, potentially violating ethical principles of holistic care and failing to utilize all available resources for the client's benefit. A third incorrect approach could involve using theological concepts to bypass necessary psychological exploration, or to offer simplistic spiritual solutions to complex psychological problems, which is a failure to apply appropriate therapeutic modalities and could be considered a form of professional negligence. Professional decision-making in such situations requires a robust understanding of both pastoral counseling theory and the specific ethical standards of the BCPC. It involves active listening, empathic attunement, and a commitment to ongoing self-education regarding diverse theological perspectives and their psychological implications. The counselor must engage in a process of discernment, carefully considering how theological principles can be integrated constructively into the therapeutic work, always with the client's well-being and autonomy as the paramount concern. This includes a willingness to consult with supervisors or colleagues when theological or ethical complexities arise. Question 10. Regulatory review indicates that a certified pastoral counselor, BCPC, is working with a client who expresses significant anxiety stemming from a belief that their current life circumstances are a direct punishment from God for past transgressions. The client is seeking relief from this anxiety and wishes to understand how their faith can guide them through this distress. Which of the following approaches best aligns with BCPC ethical guidelines and the principles of integrated pastoral counseling? Option A. Collaboratively explore the client's cognitive distortions related to punishment and sin, examining how these thoughts are impacting their anxiety, and then integrate biblical principles and theological concepts that offer a more nuanced understanding of divine justice, mercy, and forgiveness to reframe these maladaptive thought patterns. Option B. Primarily rely on prayer, scripture recitation, and spiritual direction to address the client's anxiety, suggesting that a deeper commitment to spiritual disciplines will alleviate their distress without delving into specific cognitive or behavioral patterns. Option C. Focus exclusively on teaching the client secular relaxation techniques and cognitive restructuring strategies to manage their anxiety, advising them to separate their personal faith beliefs from the therapeutic process to avoid interference. Option D. Inform the client that their theological interpretations are not within the scope of pastoral counseling and that they should seek guidance from a religious leader for spiritual matters, while the counselor focuses solely on general anxiety management techniques. The correct answer is A. Collaboratively explore the client's cognitive distortions related to punishment and sin, examining how these thoughts are impacting their anxiety, and then integrate biblical principles and theological concepts that offer a more nuanced understanding of divine justice, mercy, and forgiveness to reframe these maladaptive thought patterns. Explanation. This scenario presents a professional challenge due to the intersection of pastoral care and evidence-based therapeutic modalities like cognitive behavioral therapy, CBT. A certified pastoral counselor, BCPC, must navigate the ethical imperative to provide effective care while respecting the client's spiritual framework and adhering to professional standards. The challenge lies in integrating CBT techniques in a way that is congruent with the client's faith, avoiding spiritual bypassing, or imposing secular interpretations that might alienate or invalidate their beliefs. The correct approach represents best professional practice because it prioritizes a client-centered, integrated model. By collaboratively identifying maladaptive thought patterns and behaviors that may be exacerbated or interpreted through a spiritual lens, and then exploring how these patterns conflict with or can be reframed within the client's theological understanding, the counselor respects both the client's faith and the efficacy of CBT. This approach aligns with BCPC ethical guidelines that emphasize competence, client welfare, and the integration of diverse perspectives in a manner that is respectful and beneficial. It avoids imposing a purely secular interpretation of distress and instead seeks to empower the client to find spiritual meaning and growth through the therapeutic process. An incorrect approach that focuses solely on secular CBT techniques without acknowledging or integrating the client's spiritual beliefs fails to meet the client's holistic needs and may violate ethical principles of cultural competence and respect for client values. This could lead to a disconnect between the therapeutic work and the client's lived experience, potentially causing harm or hindering progress. Another incorrect approach that attempts to solely address distress through prayer or scripture without employing evidence-based therapeutic strategies, even when indicated by the client's presentation, may be considered a failure to provide competent care. While spiritual practices are vital, they may not be sufficient to address complex cognitive and behavioral patterns that CBT is designed to treat. This approach risks spiritual bypassing, where spiritual language is used to avoid addressing underlying psychological issues. A third incorrect approach that dismisses the client's spiritual framework as irrelevant to their psychological distress demonstrates a lack of understanding of the profound impact faith can have on an individual's worldview, coping mechanisms, and overall well-being. This is ethically problematic as it invalidates a core aspect of the client's identity and can lead to mistrust and disengagement from therapy. The professional decision-making process for similar situations should involve a thorough assessment of the client's presenting concerns, their spiritual beliefs and practices, and their openness to integrating therapeutic techniques. It requires ongoing dialogue with the client to ensure that the therapeutic approach is congruent with their values and goals. Competence in both pastoral care and evidence-based therapeutic modalities, coupled with a commitment to ethical practice, is paramount. Question 11. The audit findings indicate that in a recent counseling session, a congregant expressed significant anxiety and feelings of worthlessness, attributing these feelings to a perceived lack of divine favor. The pastoral counselor is tasked with responding in a manner that is biblically grounded and ethically sound, ensuring the congregant's spiritual and emotional well-being are addressed holistically. Option A. Immediately offer a series of scripture verses that directly address overcoming anxiety and feelings of worthlessness, encouraging the congregant to memorize and meditate on them as the primary solution. Option B. Acknowledge the congregant's feelings, validate their distress, and then explore how biblical principles of God's unconditional love and redemptive grace can offer a counter-narrative to their feelings of worthlessness, while also assessing for any underlying psychological factors that may require further professional attention. Option C. Suggest that the congregant's feelings are a spiritual attack and recommend a period of intense prayer and fasting to overcome them, without further exploration of their emotional state. Option D. Advise the congregant that their feelings are a result of their own spiritual immaturity and that they need to seek forgiveness for their lack of faith before any progress can be made. The correct answer is B. Acknowledge the congregant's feelings, validate their distress, and then explore how biblical principles of God's unconditional love and redemptive grace can offer a counter-narrative to their feelings of worthlessness, while also assessing for any underlying psychological factors that may require further professional attention. Explanation. This scenario is professionally challenging because it requires the pastoral counselor to navigate the intersection of biblical principles and professional counseling ethics, particularly when a congregant expresses distress that could be interpreted through both lenses. The audit findings highlight a potential gap in the counselor's documentation and adherence to established ethical guidelines, necessitating a response that is both biblically sound and professionally responsible. The correct approach represents best professional practice because it prioritizes the congregant's well-being and autonomy while grounding the counseling in the foundational biblical principles of love, truth, and redemption. It acknowledges the spiritual dimension of the congregant's struggle without imposing a specific theological interpretation or bypassing professional assessment. This approach aligns with the ethical standards of the Certified Pastoral Counselor, BCPC, by ensuring that counseling is conducted with integrity, competence, and respect for the individual's journey, integrating faith and psychological understanding appropriately. An incorrect approach that focuses solely on immediate spiritual pronouncements without adequate assessment risks misinterpreting the congregant's distress, potentially leading to spiritual harm, or a failure to address underlying psychological issues. This would be a regulatory/ethical failure, as it bypasses the professional duty of care and competent assessment, potentially violating principles of non-maleficence and beneficence. Another incorrect approach that dismisses the spiritual dimension entirely would also be a failure, as it ignores a core aspect of pastoral counseling and the congregant's expressed experience, thereby failing to provide holistic care and potentially violating the principle of respecting the client's worldview. A third incorrect approach that relies on anecdotal biblical interpretations without a systematic understanding of biblical counseling principles could lead to inconsistent or harmful advice, representing a failure in competence and ethical practice. Professional decision-making in similar situations requires a framework that begins with active listening and empathetic understanding of the congregants presenting concerns. This is followed by a thorough assessment that considers both psychological and spiritual factors. The counselor must then integrate biblical principles in a way that is relevant, supportive, and ethically sound, always prioritizing the congregant's welfare and informed consent. Documentation should reflect the assessment, the integration of biblical principles, and the agreed-upon course of action, ensuring accountability and adherence to professional standards. Question 12. Governance review demonstrates that a pastoral counselor is working with a client who expresses a deep understanding of God's grace, interpreting it as a complete absolution from the need to take responsibility for their actions, including recent instances of dishonesty. The counselor is tasked with responding to this client's perspective in a way that is both theologically congruent and therapeutically effective, upholding the principles of pastoral counseling. Which of the following approaches best reflects the role of grace in this counseling context? Option A. Reassure the client that God's grace is so profound that it negates any need for them to worry about the consequences of their dishonest actions, as they are fully covered. Option B. Directly challenge the client's interpretation of grace, explaining that their understanding is theologically flawed and that true grace requires them to earn forgiveness through perfect behavior. Option C. Advise the client that their perception of grace is irrelevant to the counseling process and focus solely on behavioral modification techniques without acknowledging their faith perspective. Option D. Gently explore with the client how their understanding of grace might inform their choices and actions, encouraging reflection on the relationship between divine forgiveness and personal accountability for behavior. The correct answer is D. Gently explore with the client how their understanding of grace might inform their choices and actions, encouraging reflection on the relationship between divine forgiveness and personal accountability for behavior. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the pastoral counselor to navigate the delicate balance between offering unconditional acceptance and addressing behaviors that may be harmful or violate the ethical standards of the pastoral counseling profession as defined by the BCPC. The client's perception of grace as a license to disregard personal responsibility creates a conflict between therapeutic goals and the counselor's ethical obligations. Careful judgment is required to ensure that the application of grace is therapeutic and does not inadvertently enable destructive patterns. Correct approach analysis. The correct approach represents best professional practice because it integrates the theological concept of grace with the ethical and professional responsibilities of a pastoral counselor. It acknowledges the client's experience of grace while gently guiding them towards understanding the implications of their actions and the importance of personal accountability. This approach aligns with BCPC ethical guidelines that emphasize client welfare, professional competence, and the integration of faith and psychological principles in a responsible manner. By fostering self-reflection and encouraging the client to consider the impact of their choices, the counselor upholds the therapeutic alliance and promotes genuine growth, which is a core tenet of pastoral counseling. Incorrect approaches analysis. One incorrect approach fails to acknowledge the client's theological framework, potentially alienating them and undermining the therapeutic relationship. This could be seen as a failure to practice competently within the specific context of pastoral counseling, which necessitates understanding and respecting the client's faith perspective. Another incorrect approach might overemphasize grace to the point of condoning harmful behavior, which would be a significant ethical failure. This would violate BCPC standards regarding client safety and the counselor's responsibility to promote well-being, potentially leading to further harm for the client or others. It also fails to uphold the principle of professional accountability by not addressing the consequences of actions. A third incorrect approach could dismiss the client's understanding of grace altogether, treating it as irrelevant to the counseling process. This demonstrates a lack of cultural and theological sensitivity, a failure to integrate faith and psychology effectively, and a disregard for the client's lived experience, all of which are contrary to BCPC ethical guidelines for pastoral counselors. Professional reasoning. Professionals should approach such situations by first seeking to understand the client's perspective and their understanding of grace within their faith tradition. This involves active listening and empathetic engagement. Next, they should consider how the BCPC ethical code guides their practice, particularly concerning client welfare, professional boundaries, and the integration of faith and psychological principles. The decision-making process involves discerning how to apply the concept of grace in a way that is both theologically sound and therapeutically effective, promoting client growth and accountability without judgment or condoning harmful behavior. This requires careful consideration of the potential impact of different responses on the client's spiritual and psychological well-being. Question 13. Implementation of person-centered therapy principles in a pastoral counseling session where a client expresses distress and explicitly asks for direct advice on a complex personal decision. What is the most appropriate counselor response that upholds the client's autonomy and facilitates their self-discovery? Option A. Gently steer the conversation towards theological interpretations of the client's situation, assuming spiritual guidance will resolve the dilemma. Option B. Express concern about the client's ability to handle the decision and suggest they postpone making any choices until they feel more confident. Option C. Reflect the client's feelings and encourage them to explore their own thoughts and potential solutions, emphasizing their capacity to make the best decision for themselves. Option D. Immediately provide a clear, directive solution based on the counselor's experience and understanding of similar situations. The correct answer is C. Reflect the client's feelings and encourage them to explore their own thoughts and potential solutions, emphasizing their capacity to make the best decision for themselves. Explanation. This scenario presents a professional challenge because the pastoral counselor must balance the client's expressed desire for immediate, directive advice with the core tenets of person-centered therapy, which emphasize client autonomy and self-discovery. The counselor's role is to facilitate the client's own exploration of their feelings and choices, rather than imposing solutions. This requires careful judgment to avoid inadvertently undermining the client's agency or misinterpreting their needs within the therapeutic relationship. The correct approach represents best professional practice because it upholds the foundational principles of person-centered therapy, as advocated by Carl Rogers, and integrated into the ethical guidelines for pastoral counseling. Specifically, it prioritizes providing unconditional positive regard, empathy, and genuineness. By reflecting the client's feelings and encouraging their own exploration of options, the counselor empowers the client to find their own solutions, fostering self-reliance and personal growth. This aligns with the ethical imperative to respect client autonomy and avoid paternalistic interventions. An incorrect approach that involves immediately offering specific advice or solutions fails to adhere to the client-centered model. This is an ethical failure because it bypasses the client's internal processing and decision-making capacity, potentially leading to dependency on the counselor rather than fostering independent problem-solving. It also risks imposing the counselor's own values or interpretations, which is contrary to the principle of unconditional positive regard. Another incorrect approach, such as minimizing the client's feelings or shifting the focus away from their emotional experience, represents a failure in empathic understanding. This is ethically problematic as it demonstrates a lack of genuine engagement with the client's subjective reality, which is central to building a trusting therapeutic alliance. It can leave the client feeling unheard and invalidated, hindering the therapeutic process. A further incorrect approach, such as questioning the client's motivations or expressing doubt about their ability to resolve the issue, is a violation of unconditional positive regard. This can create a conditional environment where the client feels judged, leading to defensiveness and a reluctance to share openly. Ethically, this undermines the safety and trust necessary for effective pastoral counseling. The professional decision-making process for similar situations involves first actively listening to the client's concerns and emotional state. The counselor should then reflect these feelings back to the client to ensure understanding and to encourage further elaboration. The next step is to gently guide the client towards exploring their own thoughts and feelings about the situation and potential courses of action, using open-ended questions that promote self-inquiry. The counselor's role is to be a supportive facilitator, not a director, ensuring that the client remains at the center of their own therapeutic journey. Question 14. Operational review demonstrates a pastoral counselor is working with a client experiencing significant spiritual distress related to a perceived lack of divine affirmation following a personal tragedy. The client expresses feelings of abandonment and questions their faith. The counselor has a strong theological background, but is also trained in foundational counseling techniques. Which of the following approaches best aligns with ethical pastoral counseling practice in this situation? Option A. Directly offer theological interpretations and scriptural reassurances to counter the client's feelings of abandonment, emphasizing God's unwavering presence as a direct solution to their distress. Option B. Advise the client that their spiritual questioning is a sign of spiritual immaturity and recommend they focus solely on practical, secular problem-solving to overcome their emotional difficulties. Option C. Focus exclusively on the psychological aspects of grief and loss, suggesting that spiritual beliefs are secondary and should not be the primary focus of their therapeutic work. Option D. Employ active listening and empathetic reflection to help the client explore their feelings of abandonment and their questioning of faith, using open-ended questions to facilitate their own understanding and meaning-making within their spiritual framework. The correct answer is D. Employ active listening and empathetic reflection to help the client explore their feelings of abandonment and their questioning of faith, using open-ended questions to facilitate their own understanding and meaning-making within their spiritual framework. Explanation. This scenario presents a professional challenge due to the intersection of pastoral care and counseling ethics, particularly concerning boundaries and the appropriate use of therapeutic techniques within a faith-based context. The counselor must navigate the client's spiritual distress while adhering to professional standards that prioritize client well-being and autonomy. The BCPC framework emphasizes the importance of evidence-based practices and ethical conduct, which includes understanding the limitations of one's training and seeking appropriate supervision or referral when necessary. The correct approach represents best professional practice because it acknowledges the client's spiritual framework as a valid component of their distress and integrates it into the counseling process using established, non-directive techniques. Active listening, empathy, and open-ended questioning are foundational counseling skills that allow the client to explore their feelings and beliefs without imposing the counselor's own theological interpretation. This respects the client's agency and fosters a therapeutic alliance built on trust and understanding, aligning with BCPC ethical guidelines that promote client-centered care and cultural competence. An incorrect approach that focuses solely on theological interpretation without addressing the client's emotional and psychological distress fails to meet the comprehensive needs of the client. This could be seen as a violation of ethical principles by overstepping the bounds of pastoral counseling into theological pronouncements without adequate therapeutic grounding, potentially causing further harm or spiritual confusion. Another incorrect approach that dismisses the client's spiritual concerns as irrelevant to their emotional state ignores a significant aspect of the client's lived experience and a potential avenue for healing, thereby failing to provide holistic care and potentially alienating the client. An approach that attempts to impose specific religious doctrines or solutions without client exploration can be coercive and unethical, undermining the client's autonomy and the therapeutic relationship. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting issues, including their spiritual and emotional dimensions. This involves active listening and empathic understanding to identify the core concerns. The counselor then considers which counseling skills and techniques are most appropriate and ethically sound for addressing these concerns, drawing upon their training and adhering to the BCPC Code of Ethics. When a client's issues extend beyond the counselor's expertise or involve complex theological matters that require specific spiritual guidance, consultation with a supervisor, or referral to a qualified religious leader or specialized counselor is the ethically responsible course of action. The focus remains on facilitating the client's self-discovery and healing within a safe and ethical therapeutic environment. Question 15. The risk matrix shows a congregant presenting with acute distress following a significant traumatic event, exhibiting signs of shock and disorientation. The pastoral counselor has a strong theological background but limited formal training in advanced trauma-informed crisis intervention. What is the most appropriate initial approach to impact assessment and care? Option A. Focus on the practical aspects of the congregant's situation, such as immediate needs for shelter or financial assistance, to provide tangible support. Option B. Begin by exploring the theological meaning of the event and offering scriptural comfort to reframe the experience. Option C. Conduct a thorough assessment of immediate safety, emotional state, and available support systems, while validating the client's distress and offering a supportive presence. Option D. Immediately refer the congregant to a local mental health clinic for trauma counseling, without any initial pastoral engagement. The correct answer is B. Begin by exploring the theological meaning of the event and offering scriptural comfort to reframe the experience. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a congregant experiencing acute distress following a traumatic event. The pastoral counselor must balance the immediate need for support with the ethical and regulatory obligations to provide competent and appropriate care. The complexity arises from assessing the severity of the crisis, understanding the individual's unique spiritual and emotional landscape, and determining the most effective intervention without overstepping professional boundaries or causing further harm. The counselor must also consider the potential for vicarious trauma and the need for self-care, all within the framework of the Certified Pastoral Counselor (BCPC) standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a trauma-informed, client-centered assessment. This involves actively listening, validating the client's experience, and assessing immediate safety and support needs. It aligns with BCPC ethical guidelines that emphasize competence, beneficence, and non-maleficence. A trauma-informed approach acknowledges the potential impact of trauma on an individual's beliefs, behaviors, and spiritual well-being, and seeks to create a safe and empowering environment. This approach also recognizes the importance of collaboration with other professionals if necessary, ensuring the client receives comprehensive care. Incorrect approaches analysis. One incorrect approach would be to immediately offer spiritual platitudes or theological explanations for the trauma, without first assessing the client's immediate emotional state and safety. This fails to acknowledge the client's current distress and can be perceived as dismissive, violating the BCPC ethical principle of empathy and respect for the client's experience. It also bypasses the crucial step of crisis assessment, potentially leading to inappropriate interventions. Another incorrect approach would be to focus solely on the theological implications of the event without addressing the immediate psychological and emotional impact. This neglects the holistic nature of pastoral counseling and the immediate needs of a person in crisis. It could also be seen as a failure to adhere to BCPC standards regarding the integration of psychological and spiritual care, and a lack of competence in crisis intervention. A third incorrect approach would be to refer the congregant to a secular mental health professional without any initial pastoral support or assessment. While referrals are sometimes necessary, an immediate referral without any pastoral engagement can feel like abandonment to a congregant seeking spiritual guidance during a crisis. This could violate the BCPC ethical duty to provide appropriate pastoral care and support within the scope of one's competence. Professional reasoning. Professionals should approach such situations by first establishing a safe and trusting relationship. This involves active listening and empathetic presence. The next step is a thorough crisis assessment, focusing on immediate safety, emotional state, and support systems. Following this, interventions should be tailored to the individual's needs, integrating spiritual resources with psychological support, always within the bounds of competence and ethical guidelines. If the situation exceeds the counselor's expertise or requires specialized mental health care, a thoughtful and supportive referral process, ideally with some initial pastoral bridging, is essential. Continuous self-reflection and seeking supervision are also critical components of professional decision-making. Question 16. The audit findings indicate a need to refine how pastoral counselors approach clients presenting with symptoms that could be indicative of mental health disorders, particularly when these symptoms are intertwined with spiritual concerns. Which of the following approaches best aligns with the ethical and professional standards for certified pastoral counselors, BCPC, in understanding and addressing mental health disorders within a pastoral counseling context? Option A. Prioritize interpreting the client's symptoms solely through a spiritual lens, focusing on theological explanations and guidance without considering formal diagnostic criteria for mental health disorders. Option B. Focus exclusively on identifying and diagnosing a specific mental health disorder using DSM criteria without significant consideration for the client's spiritual background or its role in their experience. Option C. Conduct a thorough assessment that integrates the client's spiritual beliefs and practices with a clinical evaluation for potential mental health disorders, developing a holistic treatment plan that addresses both dimensions. Option D. Apply a predetermined theological framework to the client's symptoms, guiding the client towards a specific spiritual interpretation of their distress before conducting any formal assessment. The correct answer is C. Conduct a thorough assessment that integrates the client's spiritual beliefs and practices with a clinical evaluation for potential mental health disorders, developing a holistic treatment plan that addresses both dimensions. Explanation. This scenario presents a professional challenge because it requires the certified pastoral counselor, BCPC, to navigate the intersection of spiritual care and mental health diagnosis, particularly when a client's presenting issues may align with multiple diagnostic categories. The audit findings suggest a need for clarity and adherence to established diagnostic criteria and ethical guidelines. Careful judgment is required to ensure that the pastoral counseling provided is both spiritually congruent and clinically sound, respecting the client's autonomy and well-being. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that integrates spiritual and psychological dimensions. This aligns with the BCPC ethical framework, which emphasizes the importance of accurate assessment and diagnosis as a foundation for effective counseling. By considering the client's spiritual beliefs and practices alongside potential mental health disorders, the counselor can develop a holistic treatment plan that addresses the client's needs comprehensively. This approach respects the client's personhood and avoids premature or inaccurate labeling, which could be detrimental to their healing process. It also upholds the principle of beneficence by seeking to do good and avoid harm through informed and appropriate care. An incorrect approach that relies solely on spiritual interpretation without considering potential mental health disorders fails to meet the professional standards of pastoral counseling. This can lead to misdiagnosis, delayed or inappropriate treatment, and potentially exacerbate the client's distress. Ethically, this approach violates the duty of care by not utilizing all available resources and knowledge to address the client's suffering. It also risks spiritualizing a treatable mental health condition, which can be disempowering for the client. Another incorrect approach that focuses exclusively on a DSM diagnosis without integrating the client's spiritual context overlooks a crucial aspect of their identity and coping mechanisms. This can result in a treatment plan that feels alienating or incomplete to the client, hindering engagement and progress. From a regulatory and ethical standpoint, This approach may fail to acknowledge the holistic nature of pastoral counseling and the unique value it brings to mental health care. It can also lead to a disconnect between the client's spiritual life and their therapeutic journey. A further incorrect approach that involves imposing a specific theological interpretation onto the client's symptoms without a thorough assessment is ethically problematic. This can be seen as a violation of client autonomy and can lead to spiritual abuse. It prioritizes the counselor's theological agenda over the client's well-being and their right to self-determination in their spiritual journey. This approach fails to recognize the diversity of spiritual experiences and the potential for genuine mental health challenges that require clinical attention. Professional decision-making process for similar situations should involve a systematic approach. 1. Thorough assessment. Conduct a comprehensive assessment that includes gathering information about the client's presenting concerns, history, spiritual beliefs and practices, and any potential mental health symptoms. 2. Differential diagnosis. Consider a range of possible diagnoses, both spiritual and psychological, that could explain the client's experiences. 3. Integration. Seek to integrate spiritual and psychological understanding, recognizing how they may influence each other. 4. Collaboration. If necessary, collaborate with other professionals, e.g., medical doctors, psychiatrists, to ensure the client receives appropriate care. 5. Ethical consultation. Consult with supervisors or ethics committees when facing complex ethical dilemmas. 6. Client-centered care. Always prioritize the client's well-being, autonomy, and goals in developing and implementing a treatment plan. Question 17. Investigation of a pastoral counselor's interaction with a client experiencing marital distress reveals a pattern of questioning. The counselor aims to understand the client's perspective on the marital issues, which questioning technique best aligns with the ethical guidelines of the Certified Pastoral Counselor (BCPC) for fostering client self-disclosure and therapeutic exploration. Option A. Asking direct, closed-ended questions to quickly ascertain specific facts about the marital problems. Option B. Utilizing leading questions that suggest potential causes or feelings related to the marital discord. Option C. Employing open-ended questions that invite detailed descriptions and reflections from the client. Option D. Interjecting personal anecdotes and interpretations to guide the client's understanding of their situation. Correct answer is C. Employing open-ended questions that invite detailed descriptions and reflections from the client. Explanation. This scenario presents a professional challenge because the pastoral counselor must navigate the delicate balance between gathering necessary information for effective counseling and respecting the client's autonomy and privacy, all within the ethical and regulatory framework of the Certified Pastoral Counselor (BCPC). The BCPC ethical guidelines, which are paramount in this context, emphasize client welfare, informed consent, and the avoidance of undue influence or coercion. The counselor's questioning techniques directly impact the therapeutic alliance and the client's willingness to disclose sensitive information. Therefore, the approach to questioning must be both therapeutically effective and ethically sound, adhering strictly to the BCPC standards. The correct approach represents best professional practice because it prioritizes open-ended, non-leading questions that empower the client to share their experiences in their own words. This method fosters trust, encourages self-exploration, and allows the counselor to gain a comprehensive understanding of the client's perspective without imposing their own interpretations or biases. Such techniques align with BCPC ethical principles that mandate respect for client dignity and self-determination, ensuring that the client remains the primary agent in their therapeutic journey. An incorrect approach that involves leading questions, such as suggesting specific feelings or experiences, represents a significant ethical failure. This technique can inadvertently steer the client's responses, leading to inaccurate information and potentially hindering genuine insight. It violates the BCPC ethical mandate to avoid manipulation and to ensure that the client's narrative is authentic. Another incorrect approach, characterized by intrusive or overly direct questioning about highly sensitive personal details without establishing sufficient rapport or obtaining explicit consent, can breach client confidentiality and trust. This can be seen as a violation of the BCPC ethical guidelines regarding privacy and the establishment of a safe therapeutic environment. Furthermore, an approach that focuses solely on the counselor's agenda rather than the client's expressed needs, using closed-ended questions that limit the client's ability to elaborate, fails to uphold the BCPC commitment to client-centered care and effective therapeutic engagement. The professional decision-making process for similar situations should involve a continuous assessment of the client's comfort level, the therapeutic goals, and the ethical boundaries. Counselors should begin with broad, open-ended questions to establish rapport and understand the client's presenting concerns. As the session progresses, questions should become more specific as needed, always with an awareness of the client's responses and willingness to engage. The counselor must remain attuned to nonverbal cues and be prepared to adjust their questioning strategy based on the client's reactions, ensuring that the process is collaborative and respectful of the client's pace and boundaries, in accordance with BCPC ethical standards. Question 18. What factors determine the most effective approach to conducting a risk assessment with a pastoral counseling client, considering their spiritual beliefs and potential for self-harm or harm to others? Option A. A comprehensive evaluation that integrates clinical observation, client self-report, collateral information, with consent, and an understanding of the client's spiritual and cultural context. Option B. Focusing exclusively on observable behaviors and ignoring the client's spiritual beliefs, as these are considered outside the scope of clinical assessment. Option C. Relying primarily on the client's self-assessment of their own risk level and their assurance that they are not a danger to themselves or others. Option D. Immediately assuming a specific diagnosis based on initial presenting concerns and tailoring the risk assessment to confirm that diagnosis. The correct answer is A. A comprehensive evaluation that integrates clinical observation, client self-report, collateral information, with consent, and an understanding of the client's spiritual and cultural context. Explanation. This scenario is professionally challenging because conducting a risk assessment for a pastoral counseling client requires a delicate balance between maintaining therapeutic boundaries, respecting client confidentiality, and fulfilling the ethical and potentially legal obligations to ensure safety. The pastoral counselor must navigate the complexities of spiritual beliefs and practices, which may influence a client's perception of risk or their willingness to disclose certain information. The counselor's role as a spiritual guide can also create a unique dynamic that requires careful consideration during assessment. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted evaluation that integrates clinical observation, client self-report, collateral information, when appropriate and consented to, and an understanding of the client's spiritual and cultural context. This holistic view allows for more accurate identification of potential risks, such as self-harm, harm to others, or neglect. It aligns with ethical guidelines that mandate counselors to assess for and manage risk responsibly, ensuring client well-being and safety while respecting their autonomy. The focus on understanding the client's unique spiritual framework is crucial for effective pastoral counseling, as it informs their worldview and decision-making. An incorrect approach that relies solely on a client's self-assessment of risk is professionally unacceptable. This fails to acknowledge that individuals experiencing distress may have impaired judgment or a distorted perception of their own safety. It also neglects the counselor's ethical duty to actively assess for risk, rather than passively accepting the client's word. Another incorrect approach that ignores the client's spiritual beliefs and cultural background is also professionally flawed. This can lead to misinterpretations of behavior, ineffective interventions, and a failure to build rapport, as it does not acknowledge the integral role these factors play in a pastoral counseling context. Furthermore, an approach that prematurely assumes a specific diagnosis without a thorough assessment is a violation of ethical practice, as it can lead to biased evaluations and inappropriate treatment plans. Professionals should employ a systematic decision-making process that begins with a clear understanding of their ethical obligations and relevant professional standards. This involves actively listening to the client, observing their behavior, and asking targeted questions to explore potential risk factors. When appropriate and with client consent, seeking collateral information from trusted sources can provide valuable context. Crucially, the counselor must integrate all gathered information, considering the client's spiritual and cultural background, to form a comprehensive risk assessment. This assessment should then inform the development of a safety plan and appropriate interventions, with ongoing reassessment as needed. Question 19. When evaluating the initial impact of trauma on a survivor seeking pastoral counseling, which of the following assessment strategies best aligns with the ethical and professional guidelines of the Certified Pastoral Counselor, BCPC, framework for fostering healing and preventing re-traumatization. Option A, encouraging the survivor to recount the traumatic event in explicit detail to gain a comprehensive understanding of the sequence of events and their immediate emotional responses. Option B, prioritizing the establishment of a safe and trusting relationship, actively listening to the survivor's narrative, validating their experiences, and collaboratively identifying immediate needs and existing coping mechanisms, while also assessing for safety concerns. Option C, implementing a standardized intervention protocol designed for general trauma survivors, assuming that the survivor's needs will fit within the predefined parameters of the protocol. Option D, immediately focusing on a detailed diagnostic assessment to categorize the trauma and determine the most appropriate clinical intervention based on established diagnostic criteria. The correct answer is B, prioritizing the establishment of a safe and trusting relationship, actively listening to the survivor's narrative, validating their experiences, and collaboratively identifying immediate needs and existing coping mechanisms, while also assessing for safety concerns. Explanation: when a pastoral counselor encounters a survivor of significant trauma, the initial impact assessment is a critical juncture that demands careful judgment. The challenge lies in balancing the immediate need for support with the potential for re-traumatization, all while adhering to professional ethical standards and the specific guidelines of the Certified Pastoral Counselor, BCPC. The BCPC framework emphasizes a client-centered, strengths-based approach that prioritizes safety and dignity. The correct approach involves a comprehensive, multifaceted assessment that begins with establishing a safe and trusting relationship. This includes actively listening, validating the survivor's experiences without judgment, and collaboratively identifying immediate needs and coping mechanisms. The focus is on understanding the survivor's subjective experience of the trauma and their current functioning, rather than imposing external diagnostic frameworks prematurely. This aligns with BCPC ethical principles that mandate competence, beneficence, and non-maleficence, ensuring that interventions are tailored to the individual's unique situation and do not inadvertently cause further harm. The process should also include a preliminary exploration of the survivor's support systems and resources, empowering them to identify and utilize existing strengths. An incorrect approach would be to immediately focus on diagnostic labeling or to push for a detailed recounting of the traumatic event. This can be re-traumatizing, overwhelming the survivor, and potentially leading to dissociation or increased distress. Such an approach fails to prioritize safety and can violate the BCPC ethical obligation to avoid harm. Another incorrect approach is to assume a standardized response or intervention without first understanding the survivor's individual needs and cultural context. This demonstrates a lack of cultural competence and can alienate the survivor, undermining the therapeutic alliance. Furthermore, neglecting to assess for immediate safety risks, such as suicidal ideation or ongoing threats, would be a significant ethical and professional failure, directly contravening the counselor's duty of care. The professional decision-making process for similar situations should begin with a commitment to ongoing self-reflection and consultation. Counselors must continuously assess their own biases and limitations, seeking supervision or peer consultation when dealing with complex cases. The BCPC framework encourages a process of ethical reasoning that involves identifying the ethical principles at play, considering the potential consequences of different actions, and consulting relevant professional guidelines and literature. Prioritizing the survivor's autonomy and self-determination throughout the process is paramount, ensuring that interventions are collaborative and respectful of their journey toward healing. Question 20. The evaluation methodology shows that a congregant during a pastoral counseling session expresses significant emotional distress, stating, "I just feel so overwhelmed by everything, and I don't know how much longer I can cope." Which reflective response best facilitates a deeper understanding of the congregant's experience while upholding professional boundaries? Option A. That's a strong statement. Are you sure you're not exaggerating how you feel? Option B. Don't worry, things will get better. You just need to have faith and stay positive. Option C. It sounds like you're feeling incredibly burdened and are questioning your ability to manage your current situation. Can you tell me more about what feels most overwhelming right now? Option D. I understand completely. I went through something very similar a few years ago, and what helped me was. The correct answer is C. It sounds like you're feeling incredibly burdened and are questioning your ability to manage your current situation. Can you tell me more about what feels most overwhelming right now? Explanation. This scenario presents a professional challenge because the pastoral counselor must navigate the delicate balance between providing empathetic support and maintaining professional boundaries, particularly when a congregant expresses distress that could be interpreted as a cry for help beyond the scope of typical pastoral care. The counselor's reflective response is crucial in assessing the depth of the distress and determining the appropriate course of action, which may involve referral to specialized mental health professionals. The correct approach represents best professional practice because it demonstrates active listening and validation of the congregant's feelings without overstepping professional boundaries or making assumptions. By reflecting the expressed emotion and inviting further clarification, the counselor facilitates a deeper understanding of the congregant's experience, which is a cornerstone of ethical and effective pastoral counseling. This aligns with the BCPC emphasis on client-centered care and the counselor's responsibility to assess the need for specialized intervention when appropriate, ensuring the client's well-being is prioritized. An incorrect approach that offers immediate solutions or advice without fully understanding the depth of the congregant's distress fails to engage in genuine reflective listening. This can lead to misinterpretations of the problem and potentially inadequate support, which is ethically problematic as it may not address the underlying issues. Another incorrect approach that involves sharing personal anecdotes of similar struggles, while well-intentioned, can shift the focus away from the congregant and onto the counselor, blurring professional boundaries and potentially invalidating the congregant's unique experience. This violates the principle of maintaining professional objectivity and client focus. A third incorrect approach that dismisses or minimizes the congregant's feelings, even subtly, is a significant ethical failure. It demonstrates a lack of empathy and understanding, which is antithetical to the core tenets of pastoral counseling and can cause further harm to the congregant. Professionals should employ a decision-making framework that prioritizes active listening, empathetic validation, and a thorough assessment of the client's needs. This involves reflecting back what is heard and felt, asking open-ended questions to encourage elaboration, and continuously evaluating whether the situation requires specialized intervention beyond the counselor's expertise. When in doubt, consultation with supervisors or peers and adherence to professional ethical codes are essential steps.